Nursing gives you wings to fly.
Yeah.
Nursing becomes the platform where you can stand and then you can leap to any field that you want to be, and still you're a nurse. That's what I love about this profession. I am a carer. I care about people, and I am a social justice activist.
We understand that nursing was not a profession that you aspire to. Do you think that that landscape is changing at all?
Yes, it is changing, and it's changing because of people like you and I who are not afraid of being identified as nurses. When we're talking about career coaching in our high schools, Nilo, we have a long way to go, because that is where opinions are formed in high school. That is where characters are built, and we can portray nursing beautifully to our students back home, and that way they will aspire to become nurses. The world is not ready for this. They are not ready for what is just about to hit them, because nurses have been taught how to cower down, but now they are realizing it is time to break down those chains.
Yes.
And it is time to bloom and blossom and to show the world what we are capable of, because baby, we are capable of a lot.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time.
Welcome back to the Nurse on Purpose podcast. Today we have a very special guest, Cate Maina, a renal nurse specialist, author, and digital health communicator making waves in healthcare education. Based in the UK, Cate is a part of the World Health Organization's FIDS group of healthcare influencers, using her platform to break down complex medical concepts into simple, digestible information for the public. She has co-authored a chapter on chronic kidney disease in a renowned renal nursing textbook and is the author of Understanding Kidney Disease in Kenya. When she's not writing books, she's creating insightful content on LinkedIn through her newsletter, A Nurse with a Pen, or sharing healthcare content on TikTok. Cate's passion for health education and digital communication is transforming the way people understand kidney disease and healthcare as a whole. I'm super excited to be diving into Cate's journey and her expertise today. Cate, you are welcome to the podcast.
Thank you so much. I'm
Yay.
flattered. What an introduction. Thank you.
You deserve it all.
Thank
You
you.
truly do. I'm so inspired by you, and the way that we met through LinkedIn was that I was really drawn to one of your posts, right? Talking about obesity and the poverty in Africa and how that is a wild conundrum. And so I really was drawn to that, and just your style of writing, how brilliant you are, how gifted I think you are writing, that captivated my attention, and I really wanted to get to know you and your story and your journey so far. So yeah, let's start by talking about that. You know, you are doing so many things. Let's begin first by just learning, who are you personally, who is Cate, and then let's transition into how you entered into the profession of nursing.
Interesting question. And thank you so much, Nilo, for having me. And thank you for taking the first step to talk to me on LinkedIn. You're a gentle soul, and I'm so happy to be here. Cate is exactly what you have described in the introduction. But beyond that, I am a friend, I am a best friend, I am a confidant, and most importantly, I am a carer. I care about people, and I am a social justice activist. I agitate for equality and equity. Perhaps because of growing up with so much injustices around me, there is a fire in my belly that just cannot be doused whenever I see people suffering. I want to make their lives better, and probably that's what makes me the nurse that I am today, because I want to alleviate people's pain and suffering. And basically, that is who I am. Even if I were not a nurse, even when I'm writing, I am always asking myself, is this going to change someone's perspective? Is it going to alleviate suffering from people? Is it going to make to leave people in a better place than I have found them? That is what drives me. Thank you.
Mm, amazing. I can feel it in your voice, in your tone, and in your writing. You truly, truly care about people. You truly care about the plight of others, and about the profession of nursing. So, what led you to pursue a career in nursing in the first place?
Ooh. Tell you what, I never wanted to be a nurse.
Oh my
Let's
goodness!
start from that.
If one more person says that to me, honestly,
I know you've heard this so
listen,
many times.
I have talked to, I don't know, countless nurses at this point, and like half of them have said, I never wanted to
I
become a nurse.
know,
I mean,
that's the thing.
it's also my story, so I'm
Look
not
at
going to be
you,
judging,
see?
but but I'm so interested to know that many other people felt the same as me. So please
Yeah,
continue. I didn't mean to
yeah.
cut you off.
Tell you, growing up surrounded by poverty back home in Kenya, and probably this is the story of many nurses from Africa who are working abroad. I do not think my story is any more unique than theirs, but they
Mm,
will tell you that growing up surrounded by poverty, surrounded by lack of money, disease, and all those things, you do not grow up wanting to be a nurse. You grow
yeah.
up wanting to be a doctor, an
Mm,
engineer, a pilot.
mhm.
Basically, you're after the moolah. You want money.
All
You
right.
want money to solve problems. So
Right.
after my high school education, and thank God I passed brilliantly, but my parents could not afford to take me to university to study what I really wanted, law. And if not law, then journalism. Those were my two things that I really wanted to do, either become a lawyer or become a journalist, either way. But
Yeah.
there came along Good Samaritan who suggested that, you know what, look for any course and I'll help you. I'll help you through college. And
Yeah.
my mom wanted to be a nurse. I came to realize this much later in life. Mom
Yeah.
wanted to be a nurse, but even for her, she did not even complete her high school because of money problems back in my granny's place.
Mm,
So when she found this advert on the newspaper that advertised for a certain college, she was
yeah.
like, you know what, I'll take it to Kate. And she brought it to me. I was like, I don't want to be a nurse, but you know what, beggars are not choosers. I'll go for the interview. So I went for the interview. And when I passed, I told this Good Samaritan, and God bless her, she catered for my education, and I studied nursing and I became a nurse. But I had a plan, Nello. My plan was to complete nursing, take that diploma to my mom, and go back to school and study journalism.
Oh, wow.
That's
My
what I
goodness.
wanted to do. But look at me, still a nurse, loving it.
Yeah, yeah. And it's
Yes,
ironic because in a lot of ways you're a journalist, right? What are you doing? You're collecting data,
yes, I am.
right? You're looking up stuff. You're kind of investigating, at least on LinkedIn. I feel like you're a journalist. And you are presenting that information to the public. You're looking for opinions, and you're actually talking with key experts in the fields that you're interested in. Not too far from journalism, is it?
No, when you put it like that, all right.
Okay. You're a nurse journalist, okay? Let's see if I can work the law part in there too. Well, you are an advocate for social
Yes, I
justice.
am.
So, in many ways, right, there's still that law component to what you're doing. And I feel like in nursing, there's so much, it's multifaceted.
Yes,
And so you can be the nurse, but you're still an advocate, right? You're still fighting for the cause of your patients. And that's what lawyers do, don't they?
yes.
So there you go. So you're all three of those wrapped up in one.
Hey,
The one
and
that you
see
didn't,
what,
the one that
this
you
is why
didn't
I
want to
love
be.
nursing. Nursing becomes a foundation. Nursing gives you wings to fly.
Yeah.
Nursing becomes the basis, it becomes the platform where you can stand and then you can leap to any field that you want to be, and still you're a nurse. That's what I love about this profession.
Yes. I love it when I hear people talk about nursing in such a way that the world has not been historically used to knowing nursing for, right? We have, and we know this, right? We're Africans, we were born and raised, and so we understand that nursing was not a profession that you aspire to. Do you think that that landscape is changing at all in our parts of the world?
In Africa,
In Africa, yes.
yes, and that's a very interesting question. I'll answer in two-pronged ways. One, yes, it is changing, and it's changing because of people like you and I who are not afraid of being identified as nurses. It is changing because when I do my TikToks, when I write, when I post something and someone comments on how brilliant they think I am and they call me Dr. Kate, I gently nudge them that I am actually a nurse. I am Nurse Kate.
Absolutely. I love that.
I do that. And I encourage my colleagues to do that. And when I was in basic nursing training in Kenya, we were vehemently cautioned not to identify ourselves as nurses so that we don't end up getting the responsibility of whatever may happen, which I call subtle threats. And it
Mm,
worked. It worked because it helped us live in the shadow of self doubt. It worked because it made us feel that unless a doctor says something, you as a nurse shouldn't. And I am glad because of social media. Social media has broken that down, and now people can see that, wait a minute, nurses know their stuff as well.
yeah. Yeah.
Oh, nursing is actually a very good profession. Oh, nurses actually can run clinics. Nurses can be practitioners. Nurses can prescribe. Nurses can diagnose. Nurses, besides being with you when you're unwell 24/7, they can do more than that. And that image has been buttressed by people who are not afraid of being identified as nurses, people who are not afraid of being associated with this profession, which was interestingly one day or back in the day seen as being an extension of medicine, or
Mm,
as if we are assistants to doctors. Yeah.
mm,
Now, that's
mm.
one way, Nilo. The other way is we still have a very long way to go, especially in Africa, because if you go to any high school today and do a random question to the students who are qualifying for their end of high school exams and ask them, what do you want to be? What do you want to pursue as a career? And I can guarantee you very few will tell you they want to be nurses. It's because of how we tend to see nursing still back in Africa as an extension of medicine, or it is for dumb people who could not become doctors. We still have that problem in Africa right now. The other day I spoke with my teacher who, thank God, taught me literature and English, and I love him to bits. But we had a conversation where he asked me a question which I replied, but he called me a doctor because I was brilliant in my reply. So I
Mm,
had to remind him, mwalimu. Mwalimu in Swahili means teacher. I said, mwalimu, I am sorry, but I cannot let you go without reminding you that I am a nurse. And the only
mm,
reason I'm doing this is because you are in a position of influence. When you stand in front of those students in my alma mater, when you talk to them, you will tell them that I am a doctor and I don't want you to lie to them. I want you to tell them that a nurse answered a medical issue. You had a question in medicine and a nurse answered, and that nurse was in this high school. That's what I want you to tell them. I want you to create the desire for them to be nurses. So when we're talking about career coaching in our high schools, Nilo, we have a long way to go because that is where opinions are formed in high school. That is where characters are built. And we can portray nursing beautifully to our students back home. And that way, they will aspire to become nurses. I have another point. The major reason right now, especially in Kenya, why people want to be nurses is to leave the country, which is sad.
Mm,
I'm so
mm,
sorry, but it is the unfortunate truth because nursing gives you a way to leave economic hardships in the country. It gives you a ticket out of poverty. It gives you a ticket out of double taxation, and so many economic downfalls happening in the country. So people are selling nursing right now, and
mm.
most of us on social media, we're selling nursing as a get out of jail card, if you know what I
Yeah,
mean. Like
absolutely.
study nursing, get out of the country, which leaves our students a little bit disillusioned or illusioned, depending on where you're coming from, because nursing is not easy work. It's
Yeah.
not easy. And those clinical placements, you're not just going to pass an assessment, you're dealing with people. So fundamentally, as a nurse, you need to care, not because it's a calling, but because that is what nursing is all about. We can do kumbaya and hallelujah and whatever we want to do and go for a party, but at the end of the day, you will need to care. So we are churning out, we've become a carousel, churning out nurses who are not really interested in caring. They're interested in getting that get out of jail card. And it's sad,
Mm,
but it is the truth. It is
yeah.
what is happening on the ground. Thank
Yeah.
you.
Wow. Thank you for sharing that. It happens everywhere. It happens in Nigeria as well. You know, it's called Jakba, right?
Oh,
There's a term for it. And
oh,
people are entering the profession for the wrong reasons.
yeah.
And not to say that seeking out a profession and you're trying to find a better life is wrong,
No.
but when it's a profession like nursing, that it's so intricately woven with the life of a patient, with the life of another human being. This is not
Yeah.
IT, this is not computers, this is caring for someone, and it requires a lot of emotional commitment. Your reason has to really go beyond financial gain. You know, that's my opinion. So I totally agree with you on that, and I really appreciate you for sharing that. You have acquired this love and this interest for renal care.
Yes.
I should use the word developed, right? Not
Yeah.
acquired.
Yeah.
But you have a passion for renal nursing.
I do.
What was it about kidney care that first captivated you? Like, was there a particularly impactful patient experience that you would say, like, seal the deal for you? Why are you passionate about renal nursing?
Wow. Interesting. You see, Nilo, in Kenya, our training is like the one in the US, where you're trained as a nurse who can be posted anywhere and you can work in any place. Why I'm saying that for those who are uninitiated is because in the UK, they train differently. They've separated pediatrics, midwifery, adult nursing, mental health. It's all different specialties, which I truly appreciate. But back home, you train in everything. So in 2017, I was working as a nurse midwife and I was on the admission desk, and our department was all in one. So we had antenatal, postnatal, NBU, labor and delivery, everything was in one. So it was one, one main door. So I admit this lady, she was 18 years old and this was her first pregnancy and she was 32 weeks. She presented with what looked like preterm labor. So at
Mm-hmm.
32 weeks, you want her to have bed rest, you want us to monitor her, and we want to knock off that labor because we are not ready to have that baby yet. If we can let the baby stay in the uterus a little bit longer, that is the safest place for the baby to be. Now, this was her first contact with maternity service, antenatal care. So she was a house help. So her employer is the one who had brought her to the hospital after noting that her legs were getting a little bit swollen, which she
Mm.
attributed to early signs of pregnancy, but she was also shocked to see that she was actually 32 weeks.
Mm.
So it's a Sunday. I let the lady go to the ward and I go home later in the day. And I had a day off on Monday. I came back on Tuesday. And in typical nursing fashion, you want to know how was the story after I admitted such and such a patient?
Yeah,
What
right.
happened?
Mm-hmm,
You admit
mm-hmm.
a mom in early signs of labor. You want to
Yeah,
know, oh, did they
yeah,
deliver? Is it a,
yeah,
like,
of
where's the
course. Yeah,
baby? How are they doing? You just want to follow up, yeah? It feels
yeah,
like nursing sometimes is a cycle of seeking closure.
yeah. Oh, yeah.
You're always seeking closure. So I went to seek closure, and one of my colleagues pulled me aside and told me, Kate, so and so, let's call her Jane. Jane died. It's like, what? I admitted her on Sunday. What are you telling me? Yeah. So she went into acute kidney failure. We referred her to the tertiary hospital in Kenya called Kenyatta National Hospital, and she died in the resus unit of the ED. And Nilo, that broke my heart. Um, See, why did she die? What did I miss? Her
Mm,
blood pressure was 120/82. I'll never forget because the admitting physician who I was with, God bless her, I love that doctor so much. Even if you did your own obs, you do your obs, but that doctor would do her obs as well. So I
mm,
remember even what she had written on her notes, 120/82, which was pretty much the same. There were traces of protein in her urine, yeah. But
mm.
how did we move from traces of protein in urine, blood pressure of 120/82
Renal failure.
to renal failure and to death? How? I, I felt I felt weak. I
Mm,
felt like I had failed as a person, as a nurse, and that that initial feeling that I had that I would take the papers to my mom and go to do journalism.
mm,
I
mm.
wanted to do that Tuesday morning. I wanted to quit nursing and say, you know what? I thank you, God. This was a sign. I was not meant for this. I'm out of
Wow.
here. Okay. I had a few weeks of mourning. The employer who had brought her to the hospital rang the department that very day and said she wanted to speak to me. And she
Mm,
said, I just want to say thank you so much because of the way you received us. Thank you so much because of reassuring us. And I am so sorry. I've lost a very good worker, but more than that, I've lost a very good friend. I've lived with her for a few years now,
mm.
and she was the breadwinner in their family.
Oh.
So I just want to say thank you. But I felt like I was not worth that word of thank you because I was beating myself inside.
Mm,
So, yeah, that event still does a number on me because she should be here.
mm,
But then again, there came an opportunity which I call God's intervention because I was headed a dark route, I have to say. Mentally, I was not okay. Our hospital matron back then, we still called the matron, came up with an opportunity. She said, "You look, my nurses," she called us her nurses. She said, "Look,
mhm.
we have an opportunity to take two nurses to back to school. We have critical care nursing, we have an anesthetist nurse, and we have nephrology." I was like, yes, please, for the nephrology. I do not know because initially people had, when we were still deliberating about what do you want to be, what do you want to do, I had anesthesia in mind. I really wanted to be a nurse anesthetist, but this event changed everything for me. I said, you know what? I'm going to do that nephrology. I do not know what it is about those kidneys that killed that lady, but no other woman is going to die of preventable kidney disease when I'm around. It's not going to
Mm,
happen. It won't happen. And if I see anything happening about the kidneys, I will learn, I will go to school, I will study everything there is to study, and I will not let anyone lose their lives. So that is how I fell in love with the kidneys, and
Wow.
the rest is history.
That is so amazing. Um, and in addition to your passion for renal nursing, you're also passionate about educating the public in Kenya, right? About proper kidney care.
Yes.
You've even written a book, right? You've co-authored
Yes.
a chapter in a textbook on
Yes, I
renal
have.
disease. Congrats.
Thank
That's
you.
amazing. I mean, that's a major accomplishment.
Thank you.
Can you share more, about that experience of writing the book and also some of the, biggest challenges that you faced when it comes to educating the public in Kenya about renal care, right? Because renal care, renal diet different in the US, in the Western world versus in Africa. So what have been some of the biggest challenges?
One of the biggest things that I consider a divine moment is when I left Kenya for the UK. And it's when I started working with a renal nurse specialist here in this country. You know, these nurses in the UK, in the renal stratosphere, they are the best. They are
Sure
knowledgeable.
is.
They know their kidneys in and out. So initially I used to feel like a goldfish in a very huge pond, but
Mm,
I came to understand that they are willing to teach me. So I joined the Association of Nephrology Nurses of the UK. I think in America it's the ANA, Association of
mhm,
Nephrology Nurses of America.
mhm,
So I joined the equivalent here in the UK, and they paired me up with a mentor. Now, you wouldn't believe it, but one of the textbooks that I used it back in Kenya when I was doing nephrology nursing, because you have to go back to school for a whole year in Kenya, and I think it's the same in the US for you to be a specialist nurse.
yeah.
So it was written by a nurse here in the UK. And you wouldn't believe, but I was given that nurse to be my mentor. She is the one I
Wow.
was paired with, and I
Amazing.
had a starstruck moment. I couldn't believe it. I just couldn't believe it. Her name is Professor Nicola Thomas. Most nurses
Mhm,
who are in the renal world will know her. Professor Nicola Thomas has written a lot extensively about kidney care, and especially about teaching the public. She has done several studies here in the UK, and also some back in she has collaborated with some nurses from Nigeria. So
mhm.
she's really into the community. She loves teaching. You can see her when she's presenting in conferences. I sit and I watch, and I'm like, oh my gosh, I wanna be you. So when they paired me with her, I learned a lot about educating the public. And then I got a job as a clinical nurse specialist in the advanced kidney care department. So this department is whereby we help patients understand what dialysis is, what kidney transplant is way before it's needed. Because Nilo, before somebody needs dialysis, if it's not an emergency, it does not occur overnight. It
Mm,
occurs over months, over years, right?
mhm,
That is
mhm.
chronic kidney disease. Yes, when we talk
Absolutely.
about acute kidney injury, that is a different story. But we say that we do not need to start people on dialysis or kidney transplant as an emergency. We need to plan for it. We need
Mhm,
to let them know how their numbers are progressing. We are
mm.
doing our best to delay the progression of the kidney disease, but at the same time, when we really need it, they will be ready for it
Yeah,
mentally, physically. They will have seen a dialysis machine, they will
yeah.
have touched the dialyzer, they will have known this is what we need to do. So I learned a lot in that clinic. Working in that role, I realized that, wait a minute. Back home, we don't have this. We really do not have this kind of thing. People start dialysis as an emergency.
As an
You know,
emergency.
emergency start of dialysis is the norm. It is not the exception, to be
Yeah,
honest. It is
yeah.
not, it is never an exception. So what I learned there is we have a very huge group of here in the UK we call them black African, Black, Asian, and minority ethnic groups. So we talk about Blacks, we talk about Asians, Black Africans, and Black British, Black Caribbean.
Mm-hmm.
They were the ones who are very much affected by chronic kidney disease. I picked this one on early. Now, the funny thing is, of all the patients who were starting dialysis as an emergency, they were the highest percentage.
Mm-hmm. Mm-hmm.
So
Mm-hmm.
I had a question. Why? How come that we are seeing them in clinic, but they are not willing to prepare for dialysis? What's really happening? And I came to realize number one is how we teach. It's how we interact with them, because people hate being told what to do.
Hmm.
People like knowing that they have the capability to do things. All you're doing is facilitating their learning. You're not teaching them.
Absolutely.
You're not
Right.
loading it over them. You're not
Right.
you're not you're not condescending. You're not telling
Yeah.
them off. No, you're not
No, you're
threatening them.
partnering with
No,
them. Mm-hmm.
you're not patronizing them either.
Mm-hmm.
So I learned that I needed to be in a position where I can, number one, create rapport, introduce myself as one of us. Please, I am one of you. Let us talk. Tell me your worries as an African man, for example. What's your biggest worry when we talk about kidney disease? What do you
Mm-hmm.
know? I want to know, what have you seen? Have you ever seen somebody with kidney disease? Have you ever seen somebody on dialysis?
Yeah.
Has anyone you know or you've read about had a kidney transplant? So I learned how to talk to them, and I'm happy to say by the time I was leaving that department, the uptake of our services had really increased. And
Mm-hmm.
I remember there was actually one particular man from Ghana, I'll never forget. He told me, Kate, you know what? I'm gonna start dialysis, okay? Because you've buggered me now. And look, I wasn't buggering him. His kidney function was only 5%, okay? He needed to start. So he
Yeah.
told me, look, I'll start, but I just want you to be there and hold my hand when I do it. And I said, yes, I'm gonna do it. And I did.
Mm-hmm.
And today, as I'm talking to you, he got a kidney transplant finally. So that's one of the story that makes me really happy to know that our people can understand and they can be listened to. And when it comes to the diet, for example, you don't tell them about sandwiches. No, no, we don't do sandwiches.
No.
We don't. Like, we don't know
No.
those stuff.
Not African
Like,
men.
no, no, no. So you need to formulate a language that really resonates with the people. All props to the education material that we have in the UK. It's catering for the Black, Asian, minority ethnic groups, which is okay because they have these very nice recipes, about jack chicken. How can you modify it? About
Mm-hmm.
fufu, how can you modify it?
Mm-hmm.
Things like that, which is amazing. But then again, I sat down and asked myself, what about the people in Kenya? If I
Mm.
go tell them, oh, you need 1.2 grams of proteins per day, I mean, I might as well be speaking Hungarian. It doesn't make sense. It
No,
does
it
not
doesn't.
make sense. If
Even
I
to
go
me, I
tell
have
them,
a hard time deciphering
no,
that.
I know, I can't figure it out myself.
Yeah.
1.2 grams,
What
what?
is that?
Our clinical instructor had tried back in Kenya by saying it should be the size of your fist, and myself, I'm like, okay, is it this fist or is
This
it this
fist,
fist?
or
Which fist are we talking about?
or my, or the fist of my husband,
I know.
which is
So,
my
which fits? So, I
whose fist?
realized that the material that we use to teach patients in Kenya and in Africa in general, Nilo, they were not created for Africans.
Yeah.
That is the truth. The materials we use, even for us in schools, it was never created for us. So the information in there is very good, and I will cram it and I will regurgitate it in your papers. If you want me to pass an exam, and I'll pass. But when you take me to practical application, there's a problem. This is why I wrote that book. Actually, let's start with authoring the chapter. Through all this journey, my mentor is still with me, Professor Nicola Thomas, and she told me, Kate, I actually want to, we're having the sixth edition of the Renal Nursing textbook. I said, oh, that is wonderful. She said, and this time I want to include a chapter on chronic kidney disease, yes, there was one initially, but I want to add on advanced kidney care, and I cannot think of anyone else who have insights like you, having worked in this unit. And I thought, I'm not ready for this. Thank you very much. I can't, like, I know this is a textbook that will be read by renal students in Kenya. This is a textbook that will be read by renal nurses here in the UK, globally. Cate Maina, Kate, is just another random girl. I am not ready for this, but this is the power of mentorship. She helped me step into that role. And she told me, I want you to just write down your thoughts and send them to me. And the moment I sent them to her and she edited and sent back to me, and I realized, wait a minute, I have so many things to say about this.
Oh my God. That's
It was
so funny.
amazing. Then
You needed the push.
after that book, then I got the inspiration to actually write specifically to the community in Africa. I know
Mm,
my book is called Understanding Kidney Disease in Kenya, but the concepts in that book can be broken down by anyone in the developing world.
yeah.
You can understand. I have likened the kidney disease to having an irrigation system where you have a pump. It's pumping water from the river. We from Africa know about rivers. We know about
Yeah.
pumping water. These
Yeah.
are things that we can actually identify with. We can talk about a hose, where if there's a leakage in the hose, then the pressure of the water is not going to be enough to irrigate your crops. So this is the kind of language I had to adopt, because I am talking to people who do not necessarily understand the kidneys. I mean, even
Yeah.
in our medical community, in our nursing community, not everyone understands about kidneys. So
Yeah.
what about the regular citizen anywhere in the world? What is
Yeah.
their knowledge level about kidneys? This is
Yeah.
why I broke it down. When I talk about kidneys and kidney transplant, I do not write frequently asked questions which you will find in a typical book. No, I ask the most innocuous question. For example,
Mm,
some people believe that if you have a cesarean section, the doctors, the unscrupulous ones, can harvest your kidneys. I had to explain the location of the kidneys and the location of the uterus and say those
mm,
are very different operations, and also help people
mm.
understand that some people are born with one kidney, and the fact that you can function with one is why you will never know that you have one kidney until probably you've gone to have a scan for other issues. And then the
Mm.
sonographer tells you, oh, by the way, did you know you have one kidney? And then
Yeah.
you'll be like, wait a minute, I had a CS in 2013. They took my kidney.
Yeah.
so so I had to write about those,
Right.
questions that you would not think about, but which the common citizen who has no medical background worries about and
Yeah.
rushes to Google to find answers. And when
Yeah.
they go to Google, they have answers. And those
Mm.
answers, some of them are just misinformation and disinformation. I hope I've answered you.
You have more than answered it, and I appreciate that. Kidney care is so important, and all care is important. Cardiac health is important, bone
Yes.
health, muscular health, kidney
Mm,
health. But I really love that you're focusing on something that is prevalent in Africa.
yeah.
And because the consequences of it can be so dire, right? I mean, we're talking about needing expensive treatment
Yes.
like dialysis, where a lot of people can't afford that. Um, anemia, bone problems, nerve damage. These are all things that can result from a disease that can be so well managed if people understood it better.
Yeah.
So I think you're doing an amazing job,
Thank you.
disseminating that information and making it simplified so that the common person can understand it. Kudos to you on that. So I'm
Thank
going to
you.
shift gears because I
Okay.
really want to talk about the nurse with a pen,
Oh.
right? I feel like it highlights your commitment, your dedication to really sharing your experiences, right? They say storytelling is like one of the most powerful tools to to share your experiences because it draws people in. And I can attest that you are a gifted writer, right?
Oh,
Just
thank
judging
you.
from your posts that I really do enjoy following. So tell me how this title came about to begin with and how it has played a huge role in your work as a nurse.
Thank you so much for that question. You've actually taken me back. Look, I always used to write on Facebook, but that is not even where the story goes. Let's go back to my childhood.
Way back.
Let's just go back there. Um, Words fascinated me since I was a little girl. I loved reading. I loved writing.
Mm.
I would have these dog-eared papers, and I would
Oh.
write any new word that I came across on a very old newspaper. I would just write it down, and I would forget about it. So my elder sister, Immaculate, God bless her, she would collect them all and bring them to me and say, "Here is your book." That's what she always said. I
Mm.
was just a small girl, and she would say, "Here is your book." And I would take them and put them under my makeshift pillow. I didn't grow up with pillows. Maybe that is why I'm so obsessed about pillows. My mom couldn't afford, my dad couldn't afford. So we would, fold clothes and just make them like pillows. I would hide my book there. So that passion for writing materialized even more when I learned about compositions. That was the gateway. I was like, oh my goodness. So I'm free to be anything. So when I hold the pen, I can create my own world. I can imagine
Mm.
anything. And why I needed that is because, Nilo, I was bullied a lot. I was
Mm.
bullied a lot by the people I went to school with, and they beat me up every opportunity they
Mm.
could get. And yeah, so I needed to escape. Yeah, I
Mm.
needed to write, to create a story where I am the hero, a story where there's a hero, a story that ends not with tears when someone is going home after being beaten, but a story
Mm.
where there's happiness. So I could create my own stories. I created the stories even when I went to high school, and I realized that when I hold the pen, I'm very happy and I loved being happy. So I could escape. When mathematics would terrorize me, I knew that I could run to my pen and I could write about maths not being my friend, and I
I
could
love
feel
it.
good about it and be able to face the next math lesson. This continued, and back in 2012, I joined Facebook and I realized, wait a minute, this is a platform to write. I'm gonna write. So I kept on posting different things, anything that would come to my mind. I would just write and create a story. And I realized that I love long form writing.
Mm.
I'm not more a Twitterati. I'm more of a
Mm.
Facebooker. And then
Mm.
eventually I came to realize there's something called blogging. Oh, so people can blog and just
Oh
write
my
about
goodness.
random things? Okay,
The
that sounds
opportunities just
good.
keep expanding.
Yes, and I started a blog. So I started a blog and it's still alive, up to date. It's www.catemimi.com. I started
Mm.
that website and I wrote about the kidneys, about nursing, about moving from Kenya to the UK, different concepts. I wrote a lot. And just when I was ready to take it to the next level, I was diagnosed with breast cancer.
Mm.
And I stopped writing because I wasn't ready to address cancer. The big scary C word, I wasn't ready to talk to the world about that. It felt
Mm.
like that was my world, and I did not want to let anyone in. Unfortunately, I am, well, or fortunately, depending on how you look at it, I'm such an authentic writer. They say that what you write is not who you are, but I think they lie, because a lot of how I write is who I really am.
Mm.
So I could not continue writing about other things while going through surgery, going through radiotherapy, and trying to figure out, why are my breasts turning against me? Just what did I
Mm.
do? I wanted to write about that, but I couldn't. So I stopped writing. And this is the thing about writing. When you stop writing, you sometimes just stop. And next week you don't write, and the other week you don't write, and then you do not write completely. My friend Annie, God bless her, she saw me on Facebook and she told me, girl, you need to go back to what you really love doing. And I said, yeah, but it feels like if I start going back on my website right now, it feels like a haunted house. It feels like it has been a whole year and a half where bats and other creepy crawlies have been hanging around, and I'll have to go and try to wade my hands through the cobwebs, and I don't know what I'm gonna find there. She told me there's something called newsletters on LinkedIn. I said, so there's an opportunity to start over? She told me give it a go. And I did. The phrase nurse with a pen is something that came about. I cannot explain, but on Facebook, anytime I would write something medical and I'm trying to explain a concept, or there is this trending videos about something and I'm trying to explain it, I would sign off with the nurse with a pen. Like, I love you. I say it in Swahili, like, I love you sincerely, the nurse with a pen. So people came to know me as the nurse with a pen because I really wanted them to know me as a nurse. I want the profession of the nurse to be, elevated and respected. So yes, I have told you about myasthenia gravis, and please remember it's from the nurse with a pen. Remember that. I want you to know it's a nurse who has broken down that concept for you. So I carried it with me. And when I was looking for the name of this newsletter, I thought, you know what? I'm not going to be too creative. It's the nurse with a pen. And it stuck. It stuck.
Creative.
And
It
since
is
then, that's
creative.
what I've been using.
My goodness. I'm sorry to hear about your breast cancer diagnosis, first of
It's
all.
okay.
How are you doing?
Amazing. I am
I mean,
cured.
yes,
Yay! I am
yes.
very happy. Yeah,
That gives me hope.
it's been how many years? 1, 2, 3, 4 years now?
Wow.
It's been 4 years now, and I'm all right. And I'm
Cancer-free
happy.
4 years. Oh,
Yes.
that's wonderful. Thank
Yeah.
God for that. The nurse with a pen, it has a ring to it. And that is when I first found you on LinkedIn, was through your newsletters.
Wow.
And I think we have that in common, is that I love to write as well. I feel like verbally I don't do as well, but
Me
when it
too.
comes to writing, I really love, love, love expressing myself
Yeah.
through writing. And sometimes it'll just be, since I've been young, I would always write my name on everything. It was like a mark of ownership, but I think it
Mm-hmm.
started from just that innate desire to use a pen to write something. And I used to do well in English, like composition and literature in high school.
Yeah.
That was like my favorite topic.
Yes.
Same thing as I continued on. I loved to write. Sometimes I would write a post and people would be like, you should really write a book. I'm
I
like,
know,
that was
right?
just a WhatsApp post. I don't know what's so special.
Yes.
I express myself a lot better because I have time to think.
Yes.
I have time to iterate the ideas that I've put down on paper. I have time to make sure that it is suitable, right, to the person who is going to be receiving it and it lands well, right?
Yes.
Part of the reason why I love to write so much is because sometimes we can be rushed with our words
Yes.
and even unthinking.
Yeah.
But when you write things down, you can delete it. I'm that person that writes and deletes, writes and deletes. And I'm like, okay, how does this sound? Does this sound kind? Does this sound nice? I don't want to be rude. I do that. So I think we share that in common. But what a powerful journey that you went through in getting to that name and that title. And I also really love that you said, I want you to know that the nurse wrote that. Like, I'm not shy about
Yeah.
who I am. I'm not running away from it. I
Yeah.
want to elevate the profession of nursing.
Yes.
And again, we share that in common.
Yeah.
They say surround yourself with people who are smarter than you. And I feel
Yeah.
like I have successfully done that.
Oh, I think it's the other way around.
No, it's not.
Honestly, you're remarkable, Nilo. You're remarkable. Even the way you speak, the
Oh,
questions you ask, it's tremendously awesome. I
oh,
can't fault you for anything, and
oh
I'm happy to
man.
know you really. And
Uh,
I tell my friends, I have a friend in the States. Her name is Mona.
yes, you better tell them.
Yes, I do.
I'm so happy to know you as well. Okay, so you have practiced in the UK and
Yes.
in Kenya. Let's dive into kind of talking about our media portrayals now, right? Because we know our African movies and the way nurses are portrayed. What is your thoughts about the way nurses are portrayed in media?
Number one is sex objects. Sorry, I have to say it.
That's true.
Some shows, and this is why I am so anti medical shows because they irritate me. I
Yeah,
want to
they're
punch
cringe.
something,
If
and
I didn't have to do this work, I would not watch them.
I know. No, I don't mind this. It's that portrayal of, for example, let me give you an illustration. There's a show where I saw that is a surgeon operating, and the nurse is holding a handkerchief to dab the sweat
Oh
of this.
my
Oh
goodness.
my word! Oh, please don't do that.
I hope the surgeon was operating on the kidney if it
Oh,
was you, so
no,
you could teach
it
them
was
what
a
to
brain
do.
surgeon, a
How
neurosurgeon, and I'm like,
insulting.
really?
Yeah.
So
Hmm.
the media's image, well, I'll speak up until the birth of TikTok, probably, and intense Instagram. Before that, the portrayal was quite distorted, and really, we are still working to get it where it should be. But it was distorted to a point that people did not think that nurses know what they are doing, that if they had a question, for example, the patient is there saying, call the doctor for me to explain this for me. You're like, I'm here, talk to me. But that is how they portray. But then again, something has changed, which I call the nursing revolution. It has changed. Look at Nurse Alice. I love that woman so much.
Yes.
Look
She
at
was, I'm
Nurse
having her
Alice.
on, she was
She
on my
is
podcast.
America's favorite nurse. She's
Yes.
going to these different shows, and she does not shy away from telling people, I am a nurse. I am Nurse Alice. That is amazing. I see nurses going into different, for example, Nurse Blake, Nurse John, they are doing comedy, and they are reminding people that I'm a comedian and I am a nurse. Not
Mm.
that I am, but no, it's
Mhm,
both of
mhm,
them. Both, I
mhm,
am both. Look at people who go into different things like journalism, for example.
mhm.
They are nurses and they are journalists. We have legal nurses. So they are coming out now. They are talking about it. And I feel that the world is not ready for this. They are not ready for what is just about to hit them, because nurses have been taught how to cower down, but now they are realizing it is time to break down those chains, and
Yes.
it is time to bloom and blossom and to show the world what we are capable of, because
Yeah.
baby, we are capable of a lot. We're
Yes.
capable of so many
Absolutely.
things. If the richest man in the world, no matter who he is, can tweet that nurses are underrated. So even if a
Yes.
doctor told
Absolutely.
you, ask a nurse, then
Yeah.
we are getting somewhere. Not
Yeah.
where we would like to be, really, but we are making steps towards
Mm.
elevating this profession to the pedestal where it should be, to earn the
Absolutely.
respect that it deserves. Because let's face it, the public trusts nurses. Research from the US, from the UK, where I am, and all over the world shows that one of the most trusted professions is nursing. So when we talk about that, then it begs the question that what type of a nurse do you want to see as a patient? Do you want a nurse who is just kind, calm, collected, and following the doctor, running with a folder? Or do you want a nurse who can stand up and challenge bad decisions? Do you want a nurse who can speak for you when you cannot speak? Do you want a nurse
Mm.
in whose hands you will feel safe? Not because they are very good at small talk, which is good, but because fundamentally, on top of their caring nature, they are brilliant. They know
Competent.
their trade. They
Yep.
know how to detect signs of a deteriorating patient. They know
Yeah.
how to suggest to
Absolutely.
the doctor that, hey,
Yep.
we need this test. What do you think? I mean, they are
Mm.
nurses who can go and do bloods and tell the doctor, look, these were the signs, we've done the bloods, we are doing this. Are you cool with that?
Yeah.
Like, I,
Yeah.
I think, and this perhaps, Nilo, comes from my time when I was sick. we go on as nurses and we are dishing medical advice and we are offering care, but when you are on that other side of the consultation table, you want to have peace of mind. And peace of mind for me as a nurse comes in ability to trust my team. The people taking care of me, I want to trust them. I want to trust my medical oncologist. I want to trust my radiologist. I want to trust my breast surgeon. I want to trust my breast clinical nurse specialist. I want to
Yeah.
trust my counselor. And I will not trust them if they do not project confidence in their trade.
Mm.
Honestly, it's not about how many hugs they will give me or feel sorry
Yeah.
for me. No,
Oh, yeah.
it is about them being confident in knowing that this is what we do, this is what we are going to do. Kate, this treatment does not suit you because of this. Oh, you have seen chemotherapy in other people. We are not going to do chemotherapy for you because of A, B, C, D.
Yep.
This is what I want. And if I have that, Nilo, if I have that, I can focus on the job of getting well. I can
Yeah.
focus on the job of going back to my independence. And I believe that is the mind of every patient out there. They want to trust us. They want to know that we know our stuff. And when they know that we know our stuff, they will relax, because we
Mm.
want them to relax enough to calm down all these stress hormones, which do
Hmm.
nothing but raise up inflammation in the
Yeah.
body, which make the treatment that we are offering even more useless to them.
Unsuccessful, right?
So I want them to trust me, and they will trust me if they know I know my thing. So this is
Absolutely.
what I want us to do. That I want the public to want nurses who know their stuff,
Mm.
nurses who know their thing. And this is
Mm.
why there's an article I wrote as a jibe to the Nursing and Midwifery Council here in the UK. I was proposing it is time to enrich the training of the United Kingdom registered nurse. It is time, because it's so expensive to study nursing. We are short charging them in how we are training them. We need to elevate it, because the
Hmm.
British public deserve even more experienced nurses, not just the clinical nurse specialist. That nurse who is on the floor in that medical surgical unit, you want a nurse who is well rounded. They know everything.
Hmm.
And that has been my agitation in nursing training. I really want well informed nurses. And that's why I believe that nursing is not just an art, but nursing is a STEM subject. It's a science, and we need to treat it as such. So yeah.
Absolutely. That's wonderful. And like you said, the education piece, right? Our professional organizations, our schools have a long way to go,
Oh
and they
yeah.
have a huge responsibility in ensuring that. And I read that letter that you wrote, and
Yeah.
I think I even commented on it with
Yes, you did.
the Midwifery Council.
Yeah.
And I think it had to do with I think
Pharmacology.
was it pharmacology,
Yes.
right? Not
Yes.
being right, not being a
Yeah.
required subject,
Yeah.
which I mean, it's unthinkable, right? Like, why would anybody? It's not even something that would ever cross your mind
Yeah.
that I would be handing out medication without understanding what it's for. So,
Yeah.
what if the patient asks me, what do I do? Go and say, oh,
You.
hold on, let me call your doctor,
No,
you
they,
know?
they they do the wrong thing, because they expect these nurses to learn on the job. But you and I know that the hospital is not a controlled learning
Right,
environment. It
right,
is it
right,
is a choice between, we need hands on the deck. We
right,
need
right.
all hands on the deck. You don't have
Yeah,
time to sit down and explain about pharmacokinetics and dynamics
yeah,
of
right,
medications.
right.
But yes, you have the drug reference book called the British National Formula, if I'm not wrong, the BNF. Yes, you can run and look at it, but that's not enough.
That's
There's
not the way
more
it's
to
supposed to
medications
be.
than what is
Yeah,
appearing there.
yeah.
That's why
It
I was
erodes
so
trust.
passionately angry about it.
I felt your anger and I had to comment because it didn't have any bearing in reality,
No.
like in the reality of what we do,
Yeah.
like where does that actually come
Yeah.
to bear in the day-to-day work that we do as nurses.
That's true. That's
So
true.
your anger was definitely justified, and I share the same.
Yes, you
So
did.
yeah. Okay, so I know I could talk to you for hours, honestly, Kate. I really could because I think you're so interesting and brilliant. But I want to kind of get to the end of our episode. I just want to ask you one quick question. If you could give advice to an aspiring nurse, particularly the ones from Africa, right, continent that we're from, that want to pursue specialized fields like renal nursing, and they want to make a global impact with their voices, what advice would you give them? How can they get started?
I would tell them start where you are. Start with what you have. Identify people within that specialty and reach out to them. Be bold. Talk to people. Tell them, look, I see what you're doing. I want to be like you. Please, how can I go about it? If someone says no, you can always identify another person. That's one. Number two, do not take no for an answer where your career progression is concerned. Sometimes we look at doors, they look closed, but all you have to do is knock. So, as a student nurse wanting to be a critical care nurse, maybe a renal nurse specialist, probably you want to go into public health, you want to do legal nursing, for example, you want to go into forensics. All you need to do is ask, really, and please use the internet. I have to say this, please, 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 please make use of the internet. There's massive information out there. And finally, 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 join LinkedIn. It's a very good networking platform. As a student, you can use it because you will see, just type any profession that you want, and it's going to bring you different nurses who are in that profession. Follow
Mm,
them, look at what they are doing, and gather some courage and drop them an email or drop them a
yeah,
message, and they will be
yeah,
happy to mentor you. It's very, very
absolutely.
nice. And if you're aspiring to be a renal nurse specialist, I'm here. Talk to me.
And we'll talk about where people can find you in just a
That's all
moment.
right.
But I want to play our game really quick so we can end our episode. So I
Mm-hmm.
play a fun game with my guests.
Okay.
Okay. And this is my jar. I
Mm-hmm.
have written out all my genres for
Okay.
movies, shows. It could be a book, it could be anything. I
Okay.
will pick one out of here, and
Mm-hmm.
you have to come up with the plot line for a movie, for instance, that features a nurse character, or it could be the nurse in the lead. Are you ready?
No, but yeah, let's do this.
You're looking at me shocked. I love it. Yeah, I know you're ready. You got this. You're the nurse with the pen. So
Okay.
this is what you do. All right, let's shake it around and see. Listen, we're African. You can write an African movie that has a nurse, you know. What would you like to see? Okay, let's see. Wow, this is interesting. So this category is actually miscellaneous. So you have
Oh,
a blank slate to do
right.
whatever you want to do. I've never picked this category out before. It's my first time picking out miscellaneous.
Okay.
So there's a
So you want a
nurse.
script?
Yes, I want your storyline for this show, movie, book, whatever it is.
Okay. So Nas Geraldine is in South Sudan.
Oh my
It's
goodness.
it's a war-torn country. It's being run by militia, and she's been helping the Dinka people, which is one of the major tribes in South Sudan. Their children are quite malnourished. So she's been helping them, trying to help them mix, milk with some supplements so that they can gain up some weight to be able to withstand malaria, typhoid, and so many other diseases that are ravaging that country like wildfire. Geraldine, though, has been blessed with the power of the pen, and she's been trying to write about the problems in South Sudan, trying to convince her government, the USA government, that it is not a wise thing to cut the aid of USAID because they now don't have those milk supplements, and she has seen too many deaths today. So as she's
Hmm.
sitting under the tree whose lives are long gone due to the drought that is on top of all the problems happening in South Sudan. She remembers that it's her birthday. and all she has to eat is a boiled egg from last night.
Mm.
She cuts it, gives it to one of the children who's looking at them, and then she writes about it. She
Mm.
writes about her birthday. She starts writing about her birthday the following day, and she just turned 33, and she is so excited, but her storyline hits the core of the matter. She talks about why she is in South Sudan, how her birthday did not mean much, but it meant everything to her because she spent it to the people who need it most. And then her story is read by everyone. And then one by one, people start donating. There are
Mm.
so many donations, and finally, there's a tiny little health center in the middle of South Sudan, and finally, those children can have their supplements. Those moms can have their mosquito nets to prevent malaria in pregnancy, and voila, the end of our story.
Oh my goodness. You are amazing. You're something
Oh
else.
my gosh, what
I
did you
just
just
love
do
your
to me?
mind. I love your mind. You just started this and it was as though you had been planning it for a long time already. Amazing. That was wonderful. Um, that's this is a true thing that people are actually going through, right? And then putting a nurse in the picture, that was wonderful. You are well deserving of your title, nurse with a pen. Kate, can you tell people where they can find you?
Oh, thank you so much. They can find me on LinkedIn under my official name, Catherine Maina. That is Catherine. I have to say that because there are so many versions of Catherine.
Yeah.
With Catherine Maina, I have a blue tick, and you can also find me on TikTok. I will share with you the link for my
Yeah.
TikTok. And Nilo just discovered that I'm also on YouTube. Oh yes, I am on
Yes.
YouTube under my
I
name,
love that.
Catherine Maina, into brackets, Kate Mimi. And yeah, those are the places that you can find me.
Awesome.
And
And
also on
all of
Twitter.
this,
Oh my gosh, I forgot.
yes.
I'm on Twitter under the handle Kate Mimi
X.
1772.
Yeah,
Yes.
we are going to share all of this on our show notes so
Yes,
our
please.
listeners will have access to this information. And finally, if you could recommend someone to be a guest on this podcast, who would it be?
Wow, that's a good question. I'm going to say Nurse Alice.
Nurse Alice was
Nurse
already
Alice.
on here.
And Nurse Blake. Has
Oh,
Blake
okay.
been?
Nurse Blake. What about the Nicola Thomas?
Yes, Professor Nicola Thomas. Oh my gosh,
Okay,
yes,
see? I
please.
just reminded you.
Yes,
You
please.
said that
She'd
name
be happy
twice
to be
already.
here. Oh my gosh. Okay, I'm hoping she would be happy to because she's very
Okay.
shy. She's painfully shy. But
Aww.
I know. Yeah, she would.
I will make sure to put her at ease, but
Yeah.
thank you. That was a wonderful recommendation. I will also drop the link to your books on the show notes so people have access to it. It was beyond amazing having you as a guest today. I can't say enough about you. I'm just listening to you. I'm just cheesing. My cheeks hurt
Why?
because I'm just smiling and I'm so excited that a fellow African sister who's also a nurse graced my podcast today. So such a pleasure. Thank you all so much today for tuning in. I hope you have gained some valuable insights into the world of nursing. Please be sure to like, subscribe, and share with your friends. Let's keep advocating together. We can do a better job of changing the narrative of nursing. Take care. Bye bye.
Thank you so much.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.